Good morning. Thank you for joining me, Sangha, and my brilliant co-host, Morten. Today we have with us Jon Thue, and he is the Chief Strategy Officer of Sensio. Welcome, Jon.
Thank you. It's a pleasure to be here.
And what a wonderful thing it is to welcome on board another Scandinavian.
Yay!
Why haven't you done this before?
Wow. Well, it's far between us. I've lived in different countries, and it's usually whenever you meet a fellow Scandinavian, it's a little sort of highlights a lot of the common references, I guess.
It is. It certainly is. Jon, so welcome on Tech Care, and it's really good to see you again. Please, a major pleasure that you've joined us and tell us about what Sensio does. But we first want to hear a bit about you.
Thank you, Martin. Yeah, actually, my journey into social care was it's not as sort of straightforward, but I've always had been in IT, and then transitioned more into healthcare, and then had a brief startup period in there, then more into sort of very hardcore medical side on the diagnostics, and then I started working in the intersection between social care and technology. And what brought me to that was the incredible need that I see and saw, and the potential opportunity there to really make an impact. So that was really exciting for me. That's also what drove me to be, or to try to be, an entrepreneur at some point. Also, the desire to make an impact. So I thought this is a very exciting time to be in social care and to try to help out.
That sounds very familiar, I must say. To be in a purpose-driven space where a lot of people come to work not necessarily for the pay, but for the difference that you can do to people's lives. So that's good to hear, Jon. Tell us a bit more about where you are just now and what the weather is like.
Yeah. Well, right now I'm in Oslo, and we got like 10 centimeters of snow earlier this week, which it's not normal for Oslo, but yeah, I guess you just have to take it for what it is. And Easter is coming up, so I guess there will be some skiing. That's for sure.
10 centimeters of snow would have shut down entire London.
For sure.
Yeah, in one day or in one night. Yeah, no, that's we're kind of used to that.
Yeah, absolutely. And so tell us about your work for Sensio and what Sensio really is.
Yeah, so I started this fall as a Chief Strategy Officer for Sensio. I'm very excited about that, both the company and the role I have. Sensio is a care tech company that was started in Norway about 2009. It's now grown to a sort of leadership position in this space in what we do in the Nordics, which is both platforms and sensors to help social care, and the focus is enabling more time for care. So everything that goes into that from the sensor and platform side is in scope for Sensio. So quite broad portfolio, but I would say that more and more focus now also on in-house sensors that we have developed ourselves, in addition to third parties. We work with a lot of different third parties. So we also try to knock down a bit of the silos that we've seen in the Nordics and now throughout Europe. So about the company is now about 150 people, so it's quite some size for a tech company in this space. It's a very fragmented industry, and that's very interesting for me, and working across many different European geographies to see how this landscape is in each country, because it varies so much. The people's needs are the same everywhere in the countries we visit, but the way it's structured can be different, and then the ecosystems are then even more different. So that's fascinating, at the same time challenging, because then makes it sometimes harder to spread good ideas and good ways of solving people's underlying issues. So that's something I'm very interested in understanding. How can we speed up adoption of useful tools that really helps people and makes an impact both for the residents and also, of course, for the staff. That's another passion of mine. Really understanding, what really makes something work for the staff. So there's a lot of talk about the staff crisis, and it's very much similar all across at least Western Europe, the lack of people and how to help people to also to want to stay in social care, because one thing is the lack of staff, but the other thing that we maybe talk less about is the increased burden on the staff, having typically more and more requirements from the resident side. There's a wave of what we say in the Nordics. We see there's a lot of dementia in the care institutions, around 80% in Norway. I hear around 70% in the UK, and I feel that that's not been maybe focused enough on the fact that that actually puts an extra strain on the staff. And then how can we then help them, because we're not really, or they're not really given more time or resources, or expect to do the same job with the same resources that they had before, but it's much more demanding now than it was only 10, 15 years ago. So that's I think that's undercommunicated, at least for people outside of our sector that maybe don't understand that fully.
Spot on, yeah.
So in your experience across different countries, how do you see the perception of technology changing with regards to both the staff as well as the service users and the residents?
I think that's a very good question. I think it's very there's several factors that impacts this, but in many places we're talking about a coordination problem. That's one part of it. How do we make sure that we get things rolling? There are different reasons for things not rolling out as intended, maybe across a country or a region. That needs to be figured out, and coordinating that is part of how you drive adoption. I think the new role of the ICSs in the UK or in England is interesting to see how that can help drive adoption of useful technology. In other places, it's been done a little bit differently, so that's also, I think, fascinating to see. For example, in Norway in particular, about 10 years ago, the government there started with structures and incentives to get the different operators to start implementing new technology. And they were technology agnostic, so they were just leaving it up to the more local units to decide what they needed, and that really created a starting point for this industry for growing faster maybe than elsewhere, because there was a market, and that then again became more mature and consolidated, and that's also part of the history of Sensio. So I think that was one way of solving it. In England, we're trying slightly different model. Is more sort of focused on, for example, care planning, which is, I think it's super important. It's great that that's getting focus. I know Morten is happy to hear that. But also another area that we're working in, which I think has shown some real value, which is I guess what's referred to in the UK as sensor-based falls prevention. That's an area that we're also very active in with a product called Roommate. We also have other third-party solutions that we use, because we also try to as I said, break down the silos here. But that's also an area where we see tremendous impact across the Nordics, and we also now start to see the same impact with users that we're testing within the UK.
I think you're touching on something that's super important, and obviously for those that are unfamiliar with the sort of Scandinavian tradition for digital health and digital social care, those countries have been quite developed with journal systems for this particular sector for quite a long time. There's a high level of standardization, high level of engaging the individuals in their own journey throughout the system. Um, a lot of things would be accessible and thereby also more firm in their terminologies and so on. And I think just what you're saying about the ICSs and the attempt to incentivize through co-funding is one of the things that definitely can help rise different technology areas to its potential and help adoption. So I think that's part of it, of course, the co-funding, but also what comes with that, just for a digital social care records perspective, is also the increased adherence to certain standards that's going to be put on the suppliers, which is something that's more traditional in a Scandinavian context, because a lot of the things that we're talking about is public. So
Hmm.
it's easy to say to everyone, if you want to sell to this sector that is public, then you have to adhere to whatever standards that are out there. And that's part of what I'm seeing, at least now. So I think that's going to help adoption. And I don't think it's going to be uh, records exclusively. As far as I understand from our interactions, it's going to be a lot of different technology areas for the social care sectors coming up. So it's just a matter of bandwidth and timeline.
And time.
Yeah.
Yeah,
Yeah,
no,
yeah, yeah.
I think the focus also on the sensor-based fall prevention is also a good area to drive adoption in, because we have seen that across the Nordics that has can have huge impact. But it's the downside is that it's quite tricky, because you have one part of this is technology, having sensors that are accurate and detect what you want to detect and have low levels of false alert, and I would say also high level of relevant alerts. There's a difference between
Mm,
false and low relevancy. That's first.
mm,
It needs to be give good signals to the staff. That's
Mm.
difficult to develop. But the second part is also around understanding how this fits into the work processes, and it's really well adapted to the situations that the frontline staff is facing. Because I think if you try to do, or if you don't have a good enough understanding of that, then you're not going to get very far. And it's just going to be another device on the wall that doesn't really deliver on the promise. And that, I think, is often not fully appreciated. So that's something that we've been working with for a long time. The example I mentioned, the roommate sensor, has been in use since 2015, 2016 in care homes in Norway, and been continuously developed, and especially on the process side and on the integration with the workflow, and making sure that it actually works for the staff. And I think that's typically something that you need to try out some technology to
mm,
discover that side of it. I guess part of that is also how to implement these things in an organization, because these these tools are very powerful, but they sometimes also open up new ways of working that
mm,
requires some change of mindset. And in a very hectic environment where the staff is already stretched in all directions, how do you make sure that you get this implemented in a good way, so that you actually get the results that you want, but also so that the employees see that this is a tool that's really helping them, and that they want to use it. Because otherwise, what you're going to see, and I'm sure there's a lot of people who are having this experience now, is that you will have great adoption during sort of only a short time period when you're doing a lot of follow-ups. And as soon as the management attention or is fading a bit because you're moving on to something else,
mm,
then it maybe dies out a bit, or it doesn't really deliver as it used to, because it required extra effort from the staff, didn't maybe give them enough benefit. So that makes it hard to sustain. And I think so that this is maybe the just as important as the technology itself is this process understanding, and getting the implementation done the right way. So that's been a learning curve for us as well. I think nobody has the magic formula right out the door. So it takes time to do this and to learn along the way. So I think that's also what we were really excited to be to be in the UK now, and also to try out the models that we have applied elsewhere. And the feedback we get is that it's also working really well in the UK. I'm very happy about that.
100%. It's we often talk about technology, and obviously this podcast is all around technology and social care. But most of the guests, raises this point that yes, technology is powerful. But it's just a tool, and it's all about the people management. It's all about change management and seamless integration, like you say, for the last mile. Because you might have the best of sensors, but if then the team members and employees don't know what to do after a signal has been received, after a bit of data has been received, then probably the whole powerful tech is lost in the translation.
Yeah,
So yeah.
I'm not sure if this is a controversial statement, but the technology is obviously made to help the residents to improve their safety and the quality of care that they get. But I think it's equally important uh, that it addresses the needs of the staff, because the staff are the ones who are actually making the impact. We're just enabling it. And if the staff doesn't want to use it or doesn't experience this benefiting them in their everyday work, it's not going to work over time.
I don't think that's controversial at all. I think that's just showing the kind of ethos that you and Sensio bring into the marketplace, and I quite frankly think that this is one of the areas where I see a difference between the Scandinavian countries and the marketplace for a company like Sensio here in the UK, is that sometimes there's been a barrier around the perception of what our teams are willing to or wanting to do. But I think, just referring back to an episode we've recorded with Professor John Glassby of Birmingham University, this is the everything to make sure that you get the what's in it for me right for everyone who's involved. And there's nobody as involved as, as you could say, the frontline staff. So
Yeah.
I think that's really cool and a great implementation key area to address.
Mm. Fantastic. So we are almost reaching towards our 30 minutes cutoff time. Would have loved to continue this discussion more, John. We have two questions for you. One is, what is your prediction for next 12 months in social care in technology? And the other one is, what question you want to leave for our next guest?
Great. Thank you. Well, prediction for the rest of 2023, I think this is a year of focus, and I think that is good. I think it's good now to start or to continue with those projects that are also the ICSs are trying to drive, both with care planning, but also with sensor-based fall prevention. I think it's good to get those things up to a certain scale, because then the collective industry will get more experience, and when you reach a certain level of maturity in this, then you also start to get this knowledge sharing, and the benefits really amplify. So I think it's good to not have too many try to do too many things at one time, and I think we're on that track. So my prediction is that we will be have advanced quite a bit, both or particularly in the UK throughout this year, based on what I have seen, the conversations that I have with people. When it comes to Europe, it's very fragmented, so it's hard to give sort of a prognosis there. But we do see that the general theme across the geographies that we are these sensors, and typically around remote monitoring. So maybe beyond what we call false prevention, it's then the sensors that help the staff free up more time with the typical manual control routines that they will have to do, and checkups, so that they can do that with more support. That's a trend that we see getting traction all across Europe, so very evenly. So I think that's going to be a key trend for our region, if you could say it like that. Question for the next guest. Well, I don't know who the next guest is, so I guess it has to be rather broad.
It's up to you.
Yes.
But I have to say, I think in terms of how do we coordinate also the industry in the broader sense, and I'm also thinking about regulatory environment as to the real conditions on the ground. We have the demographic shift that's working against us with more people needing care. At the same time, we have the staff shortage. We have technology in the middle. At the same time, we also have then how do we then work with the regulatory environment fast enough to be able to facilitate technology adoption that improves quality and that is meaningful. But I think that's super difficult question, and I see the same problem in many different European countries, and people are solving it differently. So how to have a sort of constructive dialogue and process between the industry, the operators, and the regulators to make sure that we do get meaningful progression in technology adoption. We absolutely need to maintain quality and safety, but we also need to do things that make a difference when it comes to speed of adoption.
Fantastic question there, and very close to my heart, because InvictIQ focuses on the quality management, compliance audit kind of arena, but using technology. So,
and it's a very hard topic. I don't think there's no silver bullet, but I think the first part here is it's a bit maybe I think maybe regulators are a little. It's my personal take is that it's very difficult to be a regulator. It's a very ungrateful job in many ways, because you also have to be very careful and with what you do to do things properly. And of course, it's super important. But when the pressures on the system is at the level where it is, and you also have a lot of good technologies coming in, how do you facilitate the dialogue so that you can guide the industry and create good rules for how to do this in a faster pace that we've been doing up until now, because the industry can't really sustain the situation that we have in the long term. So we know we have to solve it.
Absolutely.
That's one difficult question for our next.
It is.
Good one.
But it's at the top of my list, so I thought, why not? It's.
I think that's.
No, that's fantastic, and I'm going to summarize that. How can a necessary devil turn into a very good engine?
Yeah, absolutely.
Yeah.
It's a great question, Jon.
Thanks a lot for joining us on Tech Care. It was brilliant to see you again, and take care.
Lovely to be here. Thank you, guys.
Thank you.
Thank you for listening. Don't forget to subscribe, review, and share your favorite Tech Care podcast with your friends and colleagues. Until we meet next week,